Hello and welcome to the IBMS Biopod. I'm Rob.
And this is Becca.
These Biopods will give you an insight into Congress with exclusive interviews, behind-the-scenes chit-chat, and maybe even a drop of science.
So put down your pets, move away from the microscope, and get ready for a
Biopod Deep Dive.
Welcome to our first ever IBMS podcast.
In this series, we'll be talking to the experts who delivered sessions at IBMS Congress, discussing their specialist subjects and the wider issues within the biomedical sector.
This will be followed by a quick fire round and our regular feature, underrated, overrated, or correctly rated.
This episode covers the rapidly emerging field of point-of-care testing. So let's jump straight in with our first speaker, Dr. Sarah Glover.
Hello, we are with Sarah Glover. We are currently recording for the IBMS Biopods. Welcome, Sarah.
Hello.
Would you like to give us a quick introduction to who you are, what you do, and what you're about?
Hi, I'm Dr. Sarah Glover, so I'm a consultant clinical biochemist. I work at Harrogate and District NHS Foundation Trusts, and one of my roles within that position is clinical lead for point-of-care testing for the trust and the point-of-care testing within the community as well.
So Sarah, today at IBMS Congress, you're chairing the point-of-care testing stream, and it's the first time there's ever been one. Tell us about how that's happened, why it's come about, and how it's gone so far today.
Yeah, absolutely. So I'm really excited, honoured to have been asked to chair the session, and really excited that we've had a whole day on point-of-care here at Congress. So previously we have had individual sessions, which I think have been well attended, and point-of-care is a discipline which is growing, and that's only ever going to be the way forward. It's becoming bigger and bigger as it grows within hospitals, within acute services, and within the community. One of the things that I'm involved with at the moment is developing a qualification with the IBMS for point-of-care testing, and as part of that working group, we decided that we needed to dedicate a whole day's programme at Congress for point-of-care testing, because there are just so many interesting topics and speakers coming through at the moment. So as part of that working group, one of our remits was to develop the programme for today and to create a programme which was varied in terms of point-of-care delivery, how point-of-care fits with the wider NHS picture, and future developments within point-of-care as well.
And how popular has it been today? It looks there have been some quite packed sessions, I believe.
Yeah, absolutely. So it's always difficult to know, sort of with a new session, how many people are going to turn up for this. But the room we've been in has been full most of the morning. Lots of people have been coming through, and it's been standing room for much of the time.
Brilliant.
So it looks like it's been really successful as well. The audience have been really engaged with the topics. So hopefully that will reflect throughout the afternoon and going forward for future sessions as well.
And is this popularity because it's such a growing area? Is it because people are unsure about aspects of it? Is it because people want to specialise and move into it? Why do you think it's been so popular and there's such interest?
I think you've probably covered various aspects actually. So it is a growing area. There are more and more point-of-care devices coming on the market all of the time. There's more and more point-of-care tests. Traditionally, it was very much a biochemistry-dominated area. That's now expanding much beyond biochemistry into haematology, microbiology. Other disciplines are beginning to become aware that point-of-care can play a role within their services. It's growing beyond acute services out into the community. People are beginning to realise how point-of-care can develop to promote services closer to patients, within outpatient clinics, community settings, patients' own homes even. And I think as people are becoming aware that it's a growing area, they want to learn more about it. They want to learn about how point of care can be used for patient benefit, for the NHS benefit, how to make efficiency savings. So I think generally there is a lot of interest, there's a lot to learn, and it's a service that's growing very rapidly.
And traditionally, there have been barriers in place within the NHS. The lab is very much separate from patient-facing members of staff. Do you feel that those barriers are being broken down or dissolved at the moment?
You're absolutely right that traditionally sort of the laboratory is often seen as sort of the ivory tower, and people don't really have access to the laboratory and possibly don't really understand the processes. Point-of-care testing very much brings that laboratory testing out to the patient and out within the hospital. And where laboratory scientists are running point-of-care services, they are very much engaging with users to be out there and to provide a face for the laboratory, to provide a face for point of care services, and to engage users with how we can help them, so how we can develop services which fit with their patients, which will help their patient pathways, will optimise patient experience, and it's becoming much more of a two-way dialogue rather than the laboratory being seen as something which is behind closed doors.
And do people find that transition quite tricky? In my job, I don't speak to many members of the public on a day-to-day basis. If that suddenly changed and I had to, I don't know if I'd be very good at it.
I think the way the point of care has developed is that people who traditionally have worked within the laboratory, who have been sort of people who want to get out there and talk with people and enjoy working with people, enjoy working with clinicians, with healthcare assistants, even with patients to some extent, have naturally sort of progressed into point of care roles. And I think it's those laboratory staff who are becoming more and more interested in that area.
Is there any issue with people thinking this is kind of biomedical scientists losing their identity, or is this seen as an added thing that biomedical scientists are able to do?
I think it's very much seen as an added thing that biomedical scientists can do. And I think that's been reflected by the interest in the qualification that we're developing. So that is very much about providing a formal qualification, but also providing people with a means to make a stepping stone into point of care testing, where previously it may have been quite difficult to make that transition from the laboratory into point of care testing. So in some ways that's sort of facilitating that transition. I think there will always be biomedical scientists whose hearts are rooted within the laboratory, but then on the other hand there are people who have very different skill sets who are very, very adept at delivering point of care services out there in the bigger trust itself.
And if there was one point of care test you could have, if you could just pick one and be like, there is now a point of care test for this, what would that point of care test be for?
That's a really tricky question actually. Probably something to enable A&E to make really quick decisions about whether or not to send people home or not. It's probably actually a test that doesn't exist at the moment, maybe even one that doesn't exist within the laboratory, but it would probably be one single test that you could do within a couple of minutes where you could say, absolutely, this patient doesn't need to be in A&E, we're safe to send them home, and therefore that would save a huge amount of resources and time in lowering the risk of patients that are potentially pushed through the hospital system because they are at risk, and we can't say for certain that they wouldn't be at risk if we sent them home or not.
And are there any trends that you can see over the next kind of coming couple of years in point of care testing, specific areas it's going to move into?
Certainly one of the really hot topics at the moment is flu testing. We're already there, and that's being rolled out within lots and lots of trusts. I can see that microbiology are probably going to take point of care testing on board much more to try and make quicker decisions about antibiotic treatment or about whether people can start antibiotics. I think it's going to expand much more across the disciplines, and microbiology is probably the biggest area. Again, around antibiotic resistance, CRP testing is another thing which it's a nice recommendation at the moment. It's very slow to come off the ground, but there are significant cost savings and patient benefits which are there. It just needs to be realised and putting it into practice, but that's coming for certain.
And if there's a microbiologist sat at home listening to this thinking, I'd quite like to get into this a bit more, but I'm not sure, what would you say? How would you encourage people to get more involved in point of care testing?
Yeah, absolutely. If you've got a point of care testing team within your hospital, maybe it's just one person, maybe it's a small team, maybe it's a big team, go along to them, find out who they are, talk to them, and talk to them about what they do, what point of care services we've currently got, how it can benefit the patient, how it can benefit services. Talk to people within the hospital who maybe use point of care testing, how they see it as a benefit, and have a read as well. There's lots and lots of publications about point of care testing. There's lots of papers being published about new tests being developed and how that can be used clinically. So get yourself into some journals and have a read. But probably the biggest thing is to go out there and find someone within your trust who runs point of care. Or maybe even if you haven't got anything within your trust, go and find a neighbouring trust. Go and speak to the people who are delivering it at the moment.
Brilliant advice. I'm going to pass you over to Becca for the quick fire round.
So we're going to put you on the spot, and we're going to kick off with, what is the best piece of advice you've ever received?
The best piece of advice I've ever received would probably be, that's a really tricky one actually, you've got me there.
I'll let you think about that one.
Okay,
You might come back
we'll
to
come
it.
back to that.
Do you have a science hero?
A science hero, probably Florence Nightingale, for obvious reasons.
Yes. Okay, that's good. Can you describe your job in 3 words?
Varied, challenging, exciting.
Perfect. Do you have a favourite piece of lab equipment?
A glucose meter.
Excellent. Do you have a favourite pathogen?
Ooh, a favourite pathogen. Coming from biochemistry, pathogens isn't really my thing. I've got some really pretty ones posted up on our wall at the lab back home. Probably flu.
Okay, we'll go with flu.
I'm not very good at this quick fire thing.
That's all right. And what is your favourite thing about Congress?
The ability to learn more and networking as well. So many people within a small space that you can really network and develop.
Okay, for the final round we have overrated, underrated or correctly rated. So firstly, team building exercises. Overrated, underrated or correctly rated?
Correctly rated.
Are they rated well?
Depends what your exercise is. I think they definitely have a place. So I think it very much depends on what it is, but they certainly have their value.
Brilliant. Lab coats.
Underrated.
Underrated, a vital piece of equipment then.
Absolutely.
Socialising with colleagues.
Underrated.
Yeah. Those little messages that you write in birthday and leaving cards at work.
Overrated.
And have you got a standard message you go for?
No.
All the best, good luck in the future.
Good luck's always a good one, regardless of what it's for. Leaving, baby, wedding.
The multifunctional message.
Yeah, absolutely, yeah.
Using social media to promote the workplace.
Underrated.
And finally, night shifts.
Well, they're absolutely essential. Depends who you are, I guess.
What do you think of them? Have you had much experience in night shifts?
I've done a couple of night shifts, voluntarily I'll add, to gain experience of them. I can't say that I know anyone who enjoys them, but they're an essential component of the services that we provide.
Brilliant.
So it's essential.
Thank you very much for joining us. Thanks, Sarah.
You're very welcome.
So thanks to Sarah Glover.
Now on to our next interviewee,
Lee Peters. Morning, well, afternoon now. We are here with Lee Peters. Lee, welcome to the IBMS Biopod.
Thank you.
Excellent. Do you want to give us a few little words about who you are, what you do, and what you're about?
Okay, so my name's Lee. I currently work as a section manager in Swansea Bay Health Board. Background, I've done a lot of work in point of care testing. I'm currently doing a professional doctorate in point of care education for laboratory staff. And I'm also involved with the new IBMS point of care qualification.
I'm sure all of our listeners know what point of care testing is, but do you want to give us just kind of a rough, quick outline of where we're at with it, what's happened over the last few years and what's happening with point of care testing at the moment?
Yeah, sure. So point of care testing, as I'm sure everyone knows, is the testing of using usually handheld devices or small analyzers to test for pathology tests at the point of care or near patient. That's why it's sometimes called point of care testing or near patient testing. The scope of POCT has increased dramatically. It's not just a few small analyzers anymore. It's not just traditional tests anymore, like blood glucose or blood gases. We're now starting to move into the market of things like flus, virus, HIV, hepatitis, which is probably where the biggest growth is at the moment.
And what's driving that change?
Different governments, obviously I come from Wales, so we have the Welsh Assembly government, but also NHS England. They're trying to drive more and more testing into the community. So obviously bringing patients into the hospital to have their bloods taken, waiting for the results, then go back to the GPs or to community clinics, whereas POCT, in theory at least, allows the patient to basically go to their clinic, have the test done, and a set time later the result will be there and acted on by the pharmacist, the GP, nurse specialist. So basically improve turnaround times.
And is it an area that's going to continue to grow, or is there kind of a ceiling where there's only so much point of care testing you can do?
There's a long way to reach that ceiling. I think there are some tests that will be problematic to be done at point of care, but at the moment the growth, we're talking billions of pounds and increasing, to be honest with you, so worldwide. So more and more tests are actually being added to the point of care repertoire. We're looking at the exhibition here, and you'll notice that stands will offer centralized laboratory products, but also point of care products. And throughout Congress this year, you can see a slight increase in the amount of point of care products being displayed.
And is the ultimate aim, do you think, to improve patient care, or is it to save money, or is it to do both?
Both, because again, by pushing services out to the hospitals, you're reducing demand on places like A&E or the outpatients departments and pushing them to the clinics. That in theory will save money because, sort of a model of you go to your GP to get a request form for bloods. You then go to the hospital to get the bloods taken. You then book an appointment with your GP a week or two later to then get your results. Whereas if you, of course, just go to your GP, they may just say, take this to the practice nurse or to someone else in the practice and say, just get the bloods done and then come back an hour later, depending on what it is. And also if you're looking at, as I mentioned earlier, about flu viruses, that's about managing demand in peak, like Christmas times and over the winter period where there's a peak of user demand. If you could then say, right, go and have this blood test now, a swab test, see if you have the flu. If they're negative, they just go home. Whereas if they have, then they only treat the patients that are required, not the whole thing.
And what are the point of care facilities like at your hospital? What have you got in place?
So I'm quite lucky. My health board is very proactive with point of care. So we have a large amount of point of care, although it is still growing. So throughout my career, I've been quite lucky to have exposure to a wide variety of point of care. Other health boards and trusts, not so much, but it's growing everywhere. So it's
And any kind of problems or issues with implementation? Obviously, bringing anything new into the workplace is always going to cause some kind of issues. What are the major barriers that you've faced, and how have you overcome those?
Money is obviously because, as with everything with healthcare. So one of the issues that tends to be is that point of care testing is more expensive than central laboratory. But what you have to take into account is that because of reduced stay or quicker turnaround times, there are savings elsewhere in the system. But of course, sometimes convincing finance managers to say, we're going to spend X amount here, but someone down the line is going to save money, that can be problematic.
Yeah, of course.
There's been improved connectivity, so the more modern devices now just be linked up to the patient record. So when you do a point of care test, they go straight to the patient record. That isn't always the case, and trying to convince, again, finance to spend the money on connecting up the device, that can be a problem. But it's all about showing the benefit to the patient and convincing them there will be savings, but it just may be in another directorate or further up the pathway.
And you've been involved in the new IBMS qualification. How did that come about? Was it just a feeling there was a demand and a need for it?
There's been calls for a point of care qualification for quite some time, and I think it's always been sort of bubbling on the surface. But recently, because of the scope and the increase in use, and also the increase in demand on pathology time in point of care, it was felt that a POCT qualification was actually required. So about just over a year ago, the IBMS called a few of us together, and we met up and we discussed what we felt were the gaps in knowledge for pathology staff, for biomedical scientists. And we basically then designed a series of modules that would hopefully meet that gap.
Who's it aimed at?
So our primary audience will be at either biomedical scientists new into post in point of care, or those staff aspiring to go into POCT. It's basically designed to improve people's knowledge, but it's not really aimed at the people that have been doing it for years and years. So it's mainly at those aspiring or very new to the post.
And people who are listening to this thinking, great, that sounds like me, when can they do this qualification?
So the pilot will be launched in January next year. So we're probably thinking that the first intake will be limited, but after that it'll be like the other certificate of expert practice online. So the ones in training, quality, leadership and management, and molecular pathology. They'll be limited to about 60 then, but so hopefully we'll be releasing more information very, very soon.
Excellent. So we've got some quick fire questions for you. Put you on the spot a bit.
Excellent.
So I think we will kick off with, do you have a favourite pathogen?
Being a biochemistry BMS, I haven't really thought about that. I'm married to a microbiologist, so she's probably going to be super annoyed that I don't have a favourite pathogen. So off the top of my head, no, I don't,
That's
sorry.
fine. Can you describe your job in 3 words?
Challenging, frustrating, rewarding.
Lovely. It's a nice journey there. What's the best piece of advice you've ever been given?
My previous manager actually said after I had an interview, I was unsuccessful, and the advice he sort of gave was that you just need to just accept the result. Obviously you have to accept it, but not to dwell on it, and just basically learn the lessons and move on.
Yeah, excellent advice. Do you have a science hero?
Probably not. I think, again, throughout my education, there's been people I've admired, people that I've worked with that have really helped me grow, but no one that I've sort of gone, wow.
No one that you stuck up on your wall.
No, I've never stuck up a scientist on my wall. Perhaps I'm wrong with that, but yeah.
Do you have a favourite piece of lab equipment?
My favourite piece of lab equipment is one that don't break down. Because again, working in chemistry, they consistently break down, and they're almost spiteful. It's always at the busy time. Anyway, yeah.
And finally, what is your favourite thing about Congress?
The sharing, to be honest, of ideas, and it's quite. Laboratories can be so insular in the way that we look, and it's quite nice to actually see that the problems that we have are shared by everyone, and also sometimes you feel, we're not doing this right, or we could be doing this better. But sometimes we come here and it's like, oh, do you know what? We're actually really good at what we do, and I think sometimes it's actually good to show that we actually know what we're doing. Not necessarily, we all know what we're doing, but when we're talking to others, then it's like, yes, it's almost like a validation then, essentially.
Yeah, definitely. Great.
Okay, Lee, now we have the overrated, underrated, correctly rated round. So we'll kick off with team building exercises. Overrated, underrated,
Overrated.
Or
Overrated,
overrated,
definitely.
And why is that?
I think that it's obviously a managerial tool, and when I say overrated, I think sometimes they can be useful, but I think it's such a go-to thing. You must do this. I think sometimes people do it without actually thinking about what the outcome will be, and it's just like, oh yes, we'll go on this, and it'll definitely bring us all together. Not necessarily. You've got to think of sometimes the underlying causes of that.
Lab coats.
My wife is a health and safety manager, so underrated, because they're so vital, and everyone must wear them at every single time.
A very good tactical answer there.
Yes.
Socialising with colleagues.
Underrated, actually. I think that sometimes I come from quite a social lab, so it can be. I think that's probably better than team building, sort of going into the countryside and running around. Is sometimes just going for a meal, or you don't have to be best friends with everyone, but again, the laboratory I work in is a friendly environment, and I think that's important.
Brilliant. The little messages that you write in birthday cards and leaving cards at work.
Who thinks of these? Okay, right. We have, every time someone leaves or every time there's a birthday, a card comes around the lab, and you're always trying to think of something unique, and then you're looking around, you're like, it's not unique, and so sometimes it can be general. So I think they're probably a bit overrated, to be honest.
Social media in the workplace, as in to promote the workplace.
Oh, to promote it, underrated. I think that obviously we can't use phones in the labs, that's important, but to actually promote the work that we're doing, again, going back to the insular looking that I think laboratories can be, things like Twitter, things like Instagram, can be used, and also used educationally as well. People can actually learn from these.
And the final one is night shifts.
My view now is they're vital, so they can't be overrated. I hate them, to be honest. When I was first qualified, I loved them. It would be like an extra day off work the next day. I could stay up all day, it'd be absolutely fine. Now, with 2 young kids, they'll probably kill me if I did them on a regular basis, so...
Perfect. On that note, thank you very much, Lee.
Thanks very much.
Thanks for listening. We hope you enjoyed the episode, and don't forget, this can be used for your CPD.
See you next month for another Biopod. This is Becca.
And Rob,
Signing off. Bye.